Okay, so this is the lockdown part 2, where we're just going to finish off by looking at the Lotter's grandmother's 16 marker. Okay, so this is a bit of a weird one. However, please do not let it throw you. It's 16 marks. You're familiar with 16 markers. The way that this one is slightly different is there is application. There is no hard and fast rules on how application is spread out. So AO1, AO2, AO3, exactly how it works. But in this case, the way that we've approached it is it would be 4 marks for AO1, 4 marks for AO2, and 8 marks for AO3. So to access the full 4 marks in AO1, you would need the definition. So certain parts of the brain control certain functions. Then you would need some examples. Okay, so you know all the examples, the motor cortex, sensory, visual, auditory, language centres, whatever it is that you feel most comfortable talking about, you want to illustrate that. Okay, the next thing, and that would be for 4 marks, so you talk about definition and you would give 1 or 2 examples, and that would be more than enough for 4 marks. Then you would get 4 marks for AO2, and you need to talk about 4 things. Okay, as you'd need to make some kind of reference to damage to Baraka's area, meaning that grandmother would suffer from speech problems, and it would specifically affect her language production. You don't need to mention it wouldn't affect her understanding, but you can do if you want to. But the key thing, problems with language, specifically language production. Then you would mention, as a consequence of damage to the motor cortex, you would suffer from loss of muscle function or paralysis, and very specifically, you would want to talk about motor impairment on the right side of the body. And to get that 4th and final application point, then you need to mention the right side of the body. Okay. Then the kind of evaluation you could talk about. For 8 marks, you'd want to do 2, possibly 3 evaluation points. But remember, you want that P structure. A strength is, for example, you talk about supporting evidence with Peterson in the brain scans, and they found that when people were listening, Wernicke's area lit up, and when people were reading, Broca's area lit up. And this supports the idea of localization because it suggests that when you are conducting a certain function, a certain part of the brain is specifically involved in that. Practical applications, you could talk about it as strength or a weakness, I don't mind which, but if you're arguing a strength, you would say that if in OCD patients, if part of the brain was lesioned or the specific part of the brain was lesioned or damaged, 1/3 of the OCD patients in Doherty's sample found a reduction in their OCD symptoms. You could argue that this suggests that OCD behaviour is localised to a certain part of the brain. And that's a really important part. The fact it's localised, it's specific to a certain part of the brain. You could flip it on its head and say 2/3 didn't, and that's a problem. And that suggests there isn't localisation of mental health needs. That is absolutely fine. The key thing is you need to link it back to localisation. Evaluation methodology, there are quasi-experiments. They use quasi-experiments a lot of the time because they're looking at people with brain damage. So they can only, exactly like Sperry, they can only have people with brain damage in one and people without brain damage in another. So that could be a problem. And then you've got the theory, the potentiality theory. There you go. That is this idea that it's not one area of the brain. It controls each function. It's a suggestion. It's a mixture, or that all of the brain is controlled in all functions. It's a mixture of the two. If the behaviour is fairly simple, then it's a particular localised area. The more complex it becomes, the more you pull other functions in to the to it. So more other areas of the brain. Okay. Lashley found with the rats, and again with the rats and the mazes, you can use this idea that gradually they damaged more and more of the rat's brain. However, the rats were still able to learn a maze. This suggests there isn't a particular localized area of the brain that rats need to learn a maze. There isn't a maze learning part of the brain. It's the brain. It manages that process holistically. So as bits of the brain are damaged, it can still manage it because another part of the brain picks an area of it up as well. Okay, you could talk about Gabby Gifford. She's a bit of a tricky one, but you could do. So 8 marks, 2 evaluation points. The biggest problem I saw with this answer was the structuring. make sure that you address each assessment objective separately and effectively. Now, so occasionally a few of you embedded it throughout, and that worked well. But for some of you that are less confident on the content, you want to describe the AO1, you want to apply the AO1 to Lotta's grandmother, and then you want to evaluate. Ignore the structure of the question, describe, evaluate, refer. You do it however you want. So which you can do anyway, but make sure that it is focused and concise, and all of the assessment objective is kept together. Describe, apply, evaluate. Don't feel like you've got to pull application into evaluation, because if application is hard, evaluation is hard. Don't feel any pressure to combine the two together because of the way the question is worded. You've done this practice loads of times. Describe it, then apply it, then evaluate issues with it. And you can draw common themes and make links throughout the essay if you feel confident, but if you don't, keep it separate.